Hello, I'm Dr. Patricio Fischman. I will be briefly discussing the history of child and adolescent telepsychiatry for the Joint Telepsychiatry Toolkit by the American Academy of Child and Adolescent Psychiatry and the American Psychiatric Association. Approximately 20% of the nation's youth are diagnosed with psychiatric disorders, and you know that only about 20% of them receive some form of mental health services. As of January 2015, the Health Research and Services Administration had designated 4,000 mental health professional shortage areas. Nationally, there are about 13 child psychiatrists per 100,000 youth, and many of these psychiatrists are aging out of the psychiatric workforce. According to the Department of Health and Human Services, we need to add 10,000 providers by the year 2025 to meet the expected growth in demand. However, even if we are able to train sufficient number of child psychiatrists to meet this demand, maldistribution is likely to persist, as most child psychiatrists practice along the coasts. This access deficit affects mainly youth living outside major metropolitan areas, inner city communities, and special populations such as youth who are homeless, in foster care, or in the juvenile justice system. Telepsychiatry has the potential to address this wide gap in service delivery. Interestingly, even in the history of psychoanalysis, there's evidence of treatment from a distant side. It is well known that Sigmund Freud supervised other therapists and even treated some patients through letters sent via regular mail, as in the case of Little Hans through his father and the case of Anna O through his friend Dr. Joseph Breuer. The value of the media and telecommunication technologies to improve health was evidenced as early as in the 1920s with the broadcast of the radio doctor. Subsequently, in 1959, the University of Nebraska pioneered the use of interactive video in the form of a closed-circuit television system for educational and medical purposes, mainly in psychiatry. Then, in 1973, Massachusetts General Hospital provided consultation via telepsychiatry to the Bedford VA Hospital and to another distant medical site outside of Boston. The use of telepsychiatry with youth quickly followed. In the 1970s, a cable television link was established between Mount Sinai Hospital in New York and a child guidance clinic in East Harlem. Nurses and community health workers were trained through video conferences by a child psychiatrist at the hospital. The child psychiatrist then evaluated children and their mothers over the telemonitor in consultation with a multidisciplinary team at the patient site. The encouraging results from this pilot led to the recommendation that video conferencing be used to provide psychiatric services to underserved inner city children. In the 1990s, with the arrival of the World Wide Web, it helped to realize this goal. The revolution in webcam technologies and decreasing financial barriers converged with increasing demand for equitable access to healthcare, thus fostering the growth of telepsychiatry. Child psychiatrists were among the early adopters of this wonderful professional tool. In the early 2000s, reports of telepsychiatry's feasibility and acceptability for treating children and adolescents appeared in the scientific literature. In 2008, the ACAP was the first organization to publish practice guidelines for telepsychiatry services. However, the passing of the Ryan Haight Online Pharmacy Consumer Protection Act of 2008, created to expunge illegal online pharmacies, had the inadvertent effect of limiting legitimate telepsychiatry practice with children due to the large number of youth prescribed stimulants for the treatment of ADHD. In 2009, the University of New Mexico offered a school telepsychiatry program to support rural and frontier school-based health centers using a strength-based collaboration between the child psychiatry trainees who consulted to students, families, educators, and those who support them. The University of Maryland followed with school-based telepsychiatry to impoverish schools in rural Maryland. Schools are, of course, a naturalistic site for implementation of telepsychiatry services. In 2010, it was proposed that child telepsychiatry consultation might be even better than in-person visits for certain youth populations due to the difficulty in transporting children with challenging behaviors to distant clinics. The authenticity of the interaction with the psychiatrist over the monitor has allowed a therapeutic alliance to develop with these youth and their families. Youth with developmental disabilities such as autism may be particularly suited to the use of in-home telepsychiatry. In fact, home-based telepsychiatry is likely to become increasingly popular for all populations of youth as we move to a more patient-centered model of care. Increasingly, the Academy has been responding to many organizations and practitioners' requests for guidance in establishing a telepsychiatry service. In 2017, the Academy published an updated practice guideline and introduced a policy statement encouraging each state to accept telepsychiatry as a treatment service for youth and to reimburse for such services with parity to in-person services. 2018, the Academy introduced a policy statement for the inclusion of telepsychiatry training in the Child and Adolescent Psychiatry Fellowship curriculum, which highlights the need for training in regulatory, clinical, and technical aspects of telepsychiatry service. If the past is prelude, child telepsychiatry will increasingly be integrated within a mainstream approach to rectify workforce shortage and the maldistribution of child psychiatrists. The goal is to reach all the nation's children in need of psychiatric care and also to support the development of programs that have been implemented in many other countries around the world. By the end of this series, the question should not be why telepsychiatry, but why not telepsychiatry? For the Telepsychiatry Toolkit, I'm Dr. Patricio Fischman. A very special thanks to Dr. Deepika Shaligram for her contribution to this topic. Thank you for watching.